This is the anterior view of the neck. Here we can see the mandible. This is the mandible, and this is the anterior median line of the neck. Here we can see the anterior triangle. Totally exposed area of neck is this the anterior triangle. We can see this anterior triangle on the right side. Here we can see the superior boundary of anterior triangle that is formed by the base of the mandible. So here this is the base of the mandible, this one, and the line drawn by a orange chalk you can see here, it is the anterior boundary of the anterior triangle. So this anterior midline forms the medial boundary of the anterior triangle, and this is the posterior boundary of anterior triangle, which is formed by the sternocleidomastoid muscle. So we can see the base of mandible, anterior midline, this it extends from chin to the suprasternal notch of the sternum, and here this is the anterior border of sternocleidomastoid muscle. Now here we can see that anterior triangle is divided into 3.5 triangle on each side. First of all, the triangle, here we can see a small muscle which I am lifting up. This is the anterior belly of digastric. Same here on the right side you can see this is the anterior belly of the digastric muscle. So in between the anterior belly of digastric and anterior median line, and here base is formed by the hyoid bone. This small triangular structure is known as the submental triangle. The subcontent of this submental triangle is the submental lymph node, and the floor of this triangle is formed by the mylohyoid muscle. So this is the submental triangle of right side. Now here you can see this long ribbon-like muscle. This long ribbon-like muscle is a sternothyroid. Here you can see that it is extending from sternum to the hyoid. So it is the sternohyoid muscle, and here you can see the superior belly of omohyoid. This is the superior belly of omohyoid. So in between the anterior midline and superior belly of omohyoid, and the base is formed by the sternum, this triangular area is the muscular triangle. This is the muscular triangle. It contains only the anterior jugular vein and anterior intervenous jugular arch. Now come to the carotid triangle. Carotid triangle, it has anteroinferior, posterior and superior boundary. Here you can see the superior belly of omohyoid is forming the anteroinferior boundary of carotid triangle, and the anterior border of sternocleidomastoid, and here you can see the posterior belly of digastric just behind this gland. This is the submandibular gland. Behind this gland there is a posterior belly of digastric muscle. Posterior belly of digastric, which you can see clearly in this side. I will show you later. So here this depression in the anterior region of the neck is known as the carotid triangle. Why it is known as carotid triangle? Because it contains the great vessels of the neck, which are internal jugular vein and common carotid artery, which you can see on this side. You can see here carotid triangle and its content here. This is the common carotid artery, and here it is the internal jugular vein. This is the common carotid artery, and here it is the internal jugular vein. In between these two structures you can see a thick thread-like structure, that is your vagus nerve. This is your vagus nerve. All these structures here in this depression are covered by a sheath that is known as carotid sheath. Carotid sheath. So this triangle, which is formed by the superior belly of omohyoid, anterior border of sternocleidomastoid, and here you can see very clearly that there are two ribbon-like small muscles are there, which are extending from hyoid to the mastoid process. This is your hyoid bone, and here it is the mastoid process. So here you can see when I am pulling this sling, you can say it is moving. So this is the anterior belly of digastric, and here this one is the posterior belly of the digastric muscle, which you can see clearly. Very nice. This is the posterior belly of digastric, which is forming the superior boundary of carotid triangle. So superior carotid triangle, you can see very clearly that superior boundary of this triangle is formed by the posterior belly of digastric, superior belly of omohyoid, and the sternocleidomastoid. Behind this, within the carotid sheath which we have been removed are these two important structures, which is the internal jugular vein. Here you can see a big vein running from base of skull to the sternoclavicular joint. Sternoclavicular joint. This vein joins the subclavian vein behind the sternoclavicular joint and forms the brachiocephalic vein, which finally drain into the superior vena cava and superior vena cava, thus drain into the heart. So here you can see the common carotid artery. Now one more important thing which you can see, that common carotid artery is bifurcated here. So here the deep structure is the internal carotid artery, this is the external carotid artery. And here you can see the external carotid artery gives off 8 branches. One of them is the superior thyroid artery. This is the superior thyroid artery. This is the lingual artery. And here you can see the facial artery arising here. This is your facial artery. When I am pulling this structure, you can see it is moving here. So this is the facial artery. Facial artery, superior thyroid, lingual artery, and behind it you can see the ascending pharyngeal artery, and then 2 structures which are terminating in the behind the neck of mandible are the maxillary artery and superficial temporal artery, which we have removed. This is the temporalis muscle, and the ramus of mandible has been removed. So behind the ramus of mandible we can see very clearly that there are 2 muscles. One is the medial pterygoid and second one is the lateral pterygoid. Medial pterygoid and lateral pterygoid. Lateral pterygoid has 2 heads, upper and lower head. Upper head take origin from the infratemporal surface of the body of the sphenoid. Here you can see the upper head of the lateral pterygoid. And the lower head take origin from the lateral surface of lateral pterygoid plate of the sphenoid bone. In between these 2 heads, here you can see the upper head. This is the upper head and this is the lower head of the lateral pterygoid. And in between the 2 heads, you can see this vessel is running in between 2 heads. This is the maxillary artery which runs in between the upper and lower head of the lateral pterygoid muscle. It enters in the infratemporal fossa just behind the neck of the mandible, and here you can see the mandibular fossa and articular disc of the TMJ, temporomandibular joint. Here you can see the articular disc of the temporomandibular joint. This is the articular disc which is considered as a remnant of the lateral pterygoid muscle. Now here you can see the medial pterygoid. The upper head of medial pterygoid encloses the lower head of the lateral pterygoid muscle. So here it is the TMJ. And now one more important thing which I want to show you is the stylohyoid muscle. Here you can see the stylohyoid muscle. It is extending from hyoid to the styloid process, and here you can see a bony process, or you can feel it. This is the styloid process and this is the stylohyoid muscle which runs along the posterior belly of digastric. Behind these 2 vessels, these 2 muscles, you can see the external carotid artery enters into the infratemporal fossa and terminate into the maxillary and superficial temporal vessels. Now the important thing is that you can see that this is sternocleidomastoid muscle, and here it is receiving its nerve supply from the accessory cranial nerve, that is the 11th cranial nerve. So here in the neck we can see this is the 11th cranial nerve, this is the 10th cranial nerve, and here this is the 9th cranial nerve, that is your glossopharyngeal nerve. The one more important nerve here you can see which is arising from the mandibular nerve is the inferior alveolar nerve and lingual nerve. These are the 2 inferior alveolar and lingual nerve which have been cut down. So here you can see the inferior alveolar and lingual nerve. This is the medial pterygoid. Here you can see the temporalis muscle, fan shaped broad muscle, that is a temporalis muscle. Here you can see whole surface of temporal, and this is the under surface of the temporalis muscle. So this is all about the anterior triangle and muscles of mastication.